Let's talk a little bit about the outline for our presentation this evening. I'm going to give you a high-level overview of our program, and then we'll next segue into a little bit of facts about obesity. And I think this is really an opportunity for us to learn together how much more prevalent we think than we realize the problem is with obesity. We'll talk about surgical options for weight loss, and then we'll talk about the risks and benefits of bariatric surgery. And then finally, we'll kind of wrap things up with a unique program that we offer in our program, which is called the Virtual Pathway to Surgery. And I think that's something that you'll find really a unique service that only Guthrie is offering for bariatric surgery patients. So let's talk a little bit about our program. I'm very proud to be a part of the Guthrie Weight Loss Center. We are an MBSQIP designated comprehensive center, and you can kind of see on that screen there the different logos. And without going into all the letters, what this really means is that we have achieved the highest safety and quality standards in our industry. We work very hard to ensure that every patient, we provide the highest level of care, we provide the best quality of care, and we commit to supporting our patients long term. And we've been around for more than 10 years, going on 11 years now, and so we are an established, reputed program in their area. I am a fellowship trained surgeon, and what that means is that in addition to my general surgery training, I've undergone additional specialized training in the area of metabolic and bariatric surgery. It's something that I'm very passionate about. It's something that I've really devoted my life to, and it's a joy and a privilege for me to have the chance to take care of every individual that I come across. If you or a loved one is considering having bariatric surgery at Guthrie, just rest assured that you have a high quality program and you have a fellowship trained surgeon to give you the best possible outcomes. And I would be remiss if I didn't share with all of you that we are so blessed to have a fantastic team here at Guthrie. In addition to myself, we have bariatricians. So these are medical doctors who are specializing in the treatment of obesity and obesity-related diseases. We have a dietitian, we have a certified diabetes educator, fitness specialist, clinical psychologist, certified bariatric nurses, and a whole host of other individuals. So we really work together as a team, and we believe that this is important because approaching the management of obesity from multiple different specialist viewpoint really gives our patients the best chance for the support that they need and for long-term success. And that's what we're after, is to help our patients long-term. And I'll kind of reiterate, what I was mentioning there before, that we really commit to providing support for our patients long before surgery and long after bariatric surgery. We believe it's a lifelong, it's not just around the bariatric surgery. And we still to this day see patients, who have had surgery many years ago, just to check in with them, make sure everything's going well, offer them any support they need, as well as seeing new patients. So let's talk a little bit about some of the facts and some of the science behind obesity. We know that it's one of the most pressing healthcare challenges of our time. Currently, more than 4 out of 10 adults in the United States are obese, about almost 43%. And that's a clinical definition of obesity based on a body mass index more than 30. And one of the alarming things that we're seeing is that there's a high percentage of individuals who are teenagers who are now struggling with obesity, almost 20%, almost 1 out of 5. So that's a lot. And obesity is one of the challenges of modern times. It used to be in older times, we didn't have such high obesity rates, in the United States and around the world, but now it's really one of the most pressing healthcare challenges. And it's one of the leading causes of preventable death. In fact, it's second only to smoking as far as leading causes of preventable death, and it's expected to be the leading cause within the next 5 years. You'll see on some of my slides, I have some references here, just so you kind of know where we get the information from. If anybody has any questions, we'll also be happy to share some feedback, to share with you those resources. This is a map of the United States, and the different colors represent the percentage, or the prevalence, I should say, the technical term, the prevalence of individuals within each state who are obese. And you can see that us here in New York and Pennsylvania, we're somewhere between 25 to 35%. And so what that means is that at least 1 in 4, and in some cases 1 in 3 individuals meet the definition for obesity, and it's growing around the country. I mentioned before the body mass index. For our patients at the Guthrie Weight Loss Center, we provide a specialized body composition scale, which in addition to body mass index provides more detailed information about your body fat mass, how much total body water you have, how much muscle mass you have, a really very specific, individualized, tailored weight portfolio. This is a more commonly used metric called body mass index, which we also, of course, also provide this for our patients as well. And it's basically an estimate of how much excess weight an individual carries in comparison to someone who is considered at a normal weight. So a body mass index of greater than 30 is considered obese, and it kind of goes higher than that, class 1, class 2, and class 3 obesity, as you can see on the slides there. And then if you're between 25 to 29, you're considered overweight. So I wanted to kind of talk a little bit about what causes obesity. And I think most of us generally understand that excess weight is caused by getting in too much calories, eating and drinking too much, and then not getting enough exercise, to burn off those calories. However, we now understand from the science that that is a very rudimentary, oversimplified view of the problem. It's really much more complicated than that. And there's a whole host of factors that affect an individual's likelihood to gain weight, as well as their success in losing weight when they try to lose weight. So for example, we know that there are some genes that make individuals more predisposed to gaining weight and makes it harder for them to lose weight. We understand that the environment around us has a lot to do with availability of fresh foods, whole foods, vegetables, things like that. Socioeconomic factors. We have a lot of folks, who share with us that, when they go to the grocery store, it's far more expensive to buy healthy foods, fruits, vegetables, things that are good for you. And it's a lot cheaper to buy cheap processed junk food. And so sometimes just economic realities of being able to put food on the table for your family leads to weight gain. Psychological factors. Think about what we do when we celebrate a birthday. We have a cake, or if you have, a promotion in your job or a happy occasion in your life, we celebrate with food. By the same token, we've all seen the movie of someone going through a sad event, maybe a breakup or something, and they're eating ice cream. Why is it that we turn to food in times of emotional turmoil, either if we're really happy or if we're really sad? We understand that the psychology of how our brain works tends to go to food as a source of comfort. It's always there. It never judges us. It's always, it makes us feel better when we eat something. And so those are some psychological reasons. So there's really a whole host of factors that contribute to excess weight. And it's not just as simple as we're eating too much and not getting enough exercise. And I wanted to really kind of highlight what are the health problems that go along with excess weight. And this is just, a few of 230 or more conditions that are scientifically accepted and recognized to be either caused by excess weight or worsened by excess weight. For example, diabetes, very common in patients with obesity, heart disease, high blood pressure, high cholesterol, sleep apnea, fatty liver disease, even certain cancers. A lot of folks may not be aware of this, but there's a very strong association with likelihood of developing breast cancer, colon cancer, endometrial cancer in female patients if you've been obese for a long period of time. And so we understand that there's tremendous value in treating obesity because it is at the root cause of many health problems that come later down the line if the obesity is not managed appropriately and early on. The take-home message there really is that obesity affects every major organ system in the human body, whether it's your heart or your lungs or your GI system, every part of the human body. There's no part that is not affected by obesity in some way, shape, or form. So let's talk a little bit now about surgery. And I kind of wanted to show this illustration here, this diagram, to show the difference between laparoscopic versus open surgery. You'll see on this picture here where there's an incision up and down the middle. That's called open surgery, and that's how we used to do bariatric surgery. In the earlier eras, in the 70s, 80s, and even up to in the 90s. And with open surgery, patients had a longer recovery. Now it's laparoscopic. So you have a few small incisions. This is just a schematic. It's not exactly where the incisions are made, but it's a representative picture. You have a few small incisions. And what are the advantages with that? With laparoscopic surgery, patients have less pain, so you're much more comfortable. You have a much earlier return to daily activities, much much shorter recovery time, a much shorter hospital stay. Typically, our patients stay overnight in the hospital and then go home the next day. Some folks might stay one extra day, but usually it's 1 or 2 nights in the hospital. Very, very fast recovery. A much smaller chance of complications such as infections, hernias. So really laparoscopic surgery is the preferred approach. And I mentioned at the opening of the presentation that I did fellowship training in bariatric surgery, and that's to give me additional expertise in being able to offer these surgeries through small incisions, laparoscopic surgery, and that's how we do it at Guthrie. Let's talk a little bit about the most common surgical options for obesity. In this diagram here, you see the sleeve gastrectomy and the Roux-en-Y gastric bypass. The sleeve gastrectomy works by making the stomach smaller. We divide the stomach, make it into a long, narrow tube shaped like a banana, and then we remove the excess portion of the stomach, and that allows our patients to feel full and satisfied with less food. It's very effective. Patients have about 50% excess weight loss with this operation. And then the gastric bypass, a very commonly performed procedure for weight loss, involves making a small stomach, a small gastric pouch, and then we also bypass the first part of the intestine. And what that does is it allows our patients to not only eat less because they have a smaller stomach, but they also absorb less of what they're eating because we've bypassed the first part of the intestine. And so when we have our individual consultation, with you or any loved one who's considering bariatric surgery, we'll kind of go over the pros and cons of both surgeries, and we'll make a tailored, individualized recommendation as to what would make the most sense for you. And so I think that that's something that for yourself or for anyone who's considering bariatric surgery, you can have the full confidence that at Guthrie will offer you all the available surgical options for obesity, and we'll be able to do it in a minimally invasive fashion. So as I mentioned before, just a little bit of background on the sleeve gastrectomy. It's a long, narrow, tubular-shaped stomach. It holds roughly about 120 mLs. It's considered a restrictive procedure because we're limiting how much food and liquid can be ingested in one sitting. It is not reversible, and there's no intestinal rearrangement, and patients lose roughly about 50% or more excess weight loss. And in some cases, we use it as part of a 2-stage procedure for weight loss. In other cases, we use it as a standalone procedure. With the gastric bypass, again, you have a small gastric pouch. So food comes in, goes into the small gastric pouch, and then it goes down this picture here that's called the rulum. This part of the intestine called the rulum. And then the portion of the stomach that's off to the side will handle all the bile and pancreatic juices, and then they mix downstream over here. Very effective. It's considered a restrictive operation and malabsorptive operation. And it's about 60 to 80% excess weight loss, and it tends to be maintained better over the long term. And I should also mention that with both operations, we see a significant improvement in obesity-related health problems. With the bypass in particular, there is a substantial improvement in diabetes and reflux, as well as other obesity-related health problems. And so one thing we always, mention to anyone who is, considering bariatric surgery is that we have a national registry and we get really good estimates of how much folks would lose with different operations, but every patient is different. And so when we have an individual consultation, we'll go over what you can expect to lose with each specific procedure during a one-on-one consultation. So in terms of surgery, just like with any operation, there's certain risks and there's certain benefits with surgery. Overall, bariatric surgery is considered very safe, very effective. Patients have a short recovery, a short stay in the hospital, and they really are able to get the advantage of the operation without a lot of downtime. So weight loss is one of the benefits. But one of the things that I think a lot of folks may not realize is that there's a substantial improvement in health problems. Most people, when they're thinking about weight loss surgery, they're really thinking about it just for the weight loss purpose. But in addition to that, there is a substantial improvement in health problems, things like diabetes, blood pressure, cholesterol, sleep apnea, a whole host of conditions. Many of these conditions substantially improve. Many conditions, patients will be able to come off medications or have a lower dosage of medications. And so it's really about improving overall health, not just losing weight. And finally, and this is really important, having a better quality of life. It's not just about how much weight we lose, but it's about how much quality of life we gain. Being able to keep up with your kids and your grandkids without being winded, without being tired, having more energy, being able to enjoy a more active lifestyle, not being embarrassed about shopping for clothing, in a store or finding a comfortable sitting chair in an airplane or restaurant, things like that. So really a substantial improvement in quality of life. There are some complications that can happen with bariatric surgery. They're very rare. Common things that we worry about, infection or things like that are very rare. And when we meet for the bariatric surgery consultation, I will go over an individual risk profile for everyone who's considering bariatric surgery, so you understand not just what the generic risks are, but what your individual risk profile looks like. So as I mentioned before, it's typically a short stay in the hospital, 1 or 2 nights. Most people go back to work in 2 weeks. We do caution folks not to do any heavy lifting for about 4 weeks after surgery. So lifting heavy items, heavy pushing, pulling, things like that, just to make sure the incisions are fully healed and to avoid any hernia at the incision site. And as you can see from this slide here, we closely follow our patients after bariatric surgery just to make sure we're losing weight at a safe and healthy pace, that we're checking blood work along the way, that we're giving appropriate vitamin and mineral supplementation along the way, and just to make sure that we're there as a resource and as a support for our patients. And as I mentioned, we commit to following our patients lifelong. We've been in practice now for 11 years at the Guthrie Weight Loss Center, and we have patients who still come to see us who are from when we first opened our practice, and it's really a joy to be a part of our patient's journey. These are folks that are part of our community, and we're privileged and honored to serve them and serve their families. So again, what is the purpose of bariatric surgery? It's really about improving obesity-related health problems. There's clear scientific, research that shows the benefit with diabetes, reflux, sleep apnea, blood pressure, cholesterol, and many other conditions. And it is not cosmetic surgery. And perhaps one of the things that I think we emphasize with our folks is that it's really an effective tool to help our patients maintain weight loss over the long term. So even years out after bariatric surgery, to maintain their weight loss. And finally, I just wanted to mention a unique program that we offer here at Guthrie. We recognize that as a rural healthcare system, many of our folks are driving long distances for routine doctor's visits. We're proud to offer the virtual pathway to surgery. It's an opportunity for our patients to undergo the routine office visits and consultations that are part of the preparation before surgery in a virtual format. So from the convenience and privacy of your own home, on your cell phone or your tablet or mobile device or desktop computer, it saves you, time for traveling back and forth, time on fuel, expenses for fuel. And it's really very convenient, and it allows our patients to stay more engaged and connected with us. And all of our practitioners, all of our providers in our practice see patients in person as well as virtually. So if this is something that you're interested in or considering, we would be more than happy to share with you and help you get started on that program. And so with that, I just want to take a moment to really thank you for the privilege of your time. I realize it's a Friday evening. I want to thank you all very much for spending some time with us. And again, I just want to reiterate again before we open up for questions, if there was anyone who was with us when we had the technical issues the last time, our apologies for that. And I also want to thank you all for being a part of our seminar this evening. And so with that, I will kind of wrap up my presentation, and I will turn it over to Miss Kristen.
All right. Thank you, Dr. Aman. So I'm not seeing any questions in the chat. Go ahead and use that chat feature if you're able to, if you do have questions. But if you would like to unmute yourself and ask a question, please go ahead and do that as well. We'll just give you a few minutes to think about the questions that you might have. I'll let you know you all did miss quite a chorus of dogs while Dr. Aman was presenting, so they have fortunately gotten very quiet. All right, Dr. Aman, I am not seeing, oh, here we go. Here's one. From Theora, Dr. Aman, what is class 3 on the BMI schedule?
That would be considered at a BMI of 40 or greater. And it's height over weight. Height and weight are the two things that we look at for BMI. And so BMI of 40 or greater, we would consider class 3. And that would certainly qualify for bariatric surgery as well.
That was my question, Dr. Aman. It's been a long time since I've heard one of your presentations. And what BMI do you begin to consider someone a candidate for surgery?
Excellent question. We offer bariatric surgery for anyone with a BMI of 35 or greater, with obesity-related comorbidities, and certainly anyone with a BMI of 40 or greater, who whether or not they have obesity-related comorbidities. And it's actually a very timely question, Kristen, because there was actually just updated guidelines released last week, that patients who have a BMI between 30 to 35 and who have diabetes would benefit from bariatric surgery. And I think a lot of health insurance plans are looking at approving that patient cohort. So, certainly anyone who has a BMI within the 30s and has any obesity-related comorbidities would qualify for surgery.
Wonderful. So we have a question from a name that I'm not going to try to pronounce because I'm going to butcher it, but how much are these surgeries, and is there a price difference between the two that you mentioned tonight?
Excellent question. So we have an insurance specialist. Every individual who's interested in bariatric surgery or who's considering bariatric surgery, we have you share your insurance card information, and then we verify with your insurance benefits exactly what the cost would be for you, not only for office visits, before and after surgery, but also for the cost of the operation and hospital stay. So our insurance specialists will be able to give you, what the coverages, and insurance companies would cover your bariatric surgery. They would have approval for bariatric surgery, and they'd be able to tell you exactly what your, copay or deductible would be. And then the second part of the question to looking at the difference between sleeve versus bypass, they're both the same. There might be a small price difference between the two depending on each individual insurance plan's contract with the hospital, but from your standpoint as the patient, as far as your out-of-pocket expenses, it's the same.
Great. Theora has another question. What health situations would make a patient not be able to have surgery?
Great question, Theora. Really very rare circumstances where we feel that someone is not safe to place under anesthesia for surgery. So for example, that would be someone, say, for example, who has a heart transplant and is on, steroids for their heart, has a very high risk of going under general anesthesia. Or someone who has, a medical condition where we feel like it would be, really unsafe to put them under anesthesia. In my years of experience, it's a very, very rare circumstance, few in between, where we see a patient who is not safe to place under anesthesia for surgery. And so when we have an individual consultation, we'll take your comprehensive health history, your medical history, review your medications, and we'd be able to tell you right then and there if we think that you're a reasonable candidate. In some patients, we may obtain, additional basic testing, but for the most part, it's very rare that someone is not a safe candidate for surgery.
Right. Another question from Belinda this time. If you're a patient in the non-surgical program at the Weight Loss Center, how would you go about getting a consultation for weight loss surgery?
Oh, absolutely. Just reach out to us, give us a call, and let us know that you're interested in the surgical weight loss program, and we'll be happy to schedule you with one of our team members. We'll be happy to do that.
All right, here's what I'm going to try to paraphrase. So after surgery, our attendee thinks that she will no longer be able to take naproxen for pain. Wonders what other pain medicines after bariatric surgery can be used for anti-inflammatory issues.
That's a great question. So there is a concern that is true. There is a concern with using some of the over-the-counter pain medication with gastric bypass surgery, things like Advil, Aleve, ibuprofen, Motrin, things like that. But it's only with gastric bypass specifically, not with sleeve. So with sleeve gastrectomy, there's no concern with those medications. With gastric bypass, after surgery, we don't want to take those medications, particularly not take them on a long-term or on a regular basis, because they can cause problems in the stomach. So for those patients, there are other non-NSAID medications that we can provide to help with pain control in the patients who've had gastric bypass, and we can review those medications with you. But generally speaking, it is true, we want to avoid the NSAIDs after gastric bypass surgery specifically, but it's not a concern with the sleeve. There's no problem with taking those medications.
Right, we're getting lots of great questions tonight. Here's another one. Does an individual usually have better weight loss results after the sleeve or the full bypass, Roux-en-Y bariatric surgery?
That's an excellent question. Generally speaking, gastric bypass patients tend to have a little more weight loss in the sleeve, but perhaps more importantly, they tend to maintain the weight loss a little bit better over the long term as compared to the sleeve gastrectomy. And so when I meet with patients, one of the things that I do is I will share a graph or picture that shows you what your estimated weight loss is with each procedure and what you can expect in terms of maintaining that weight loss over the long term. The other thing that I always share with folks too is that it's very common that folks will share notes or compare notes. You know, I have a friend who had this operation, or so-and-so had this operation, or maybe you're part of an online support group. And one of the things that's unique about bariatric surgery is that the weight loss is very individual. It's very specific to each individual. So you can have two folks, for example, have gastric bypass. Let's say one person is, 265 pounds, and the other person is 400 pounds. So the person who weighs a little bit higher is going to lose more weight than the other person because they have more weight to lose, even though they're both having the same operation. And so I think in terms of understanding what the benefit might be to you or to your loved one or a family member who might be thinking about bariatric surgery, we offer an individual tailored weight loss prediction based on our MBS national accredited program that gives you an idea of what you can expect to lose with each operation and what you can expect in terms of maintaining that weight loss over the long term.
Right. So we have run out of questions in the chat. Oh, here we go. From Belinda, do you assist with skin removal if it is needed?
Yes, great question. Very commonly asked question. So yes, we do have, once someone has lost all their weight, if they are unsatisfied with excess or loose skin or are having any, issues with that, sometimes it's hygiene issues, sometimes it's rubbing or causes friction or just unsightly in general. We have an outstanding plastic surgery team here at Guthrie. I've had many patients over the years who've had skin removal surgery and have been very pleased with the results. But the other part of it too, to be honest with you, is that I'll tell you that I get a lot more questions about, loose skin or excess skin before surgery and far fewer afterwards. And I think the reason for it is that, I think, Belinda, a lot of folks find that it's not as much as they thought it was going to be, or it's not as loose as they imagined it would be, and it's not as much of a concern as they thought it would be. So most patients end up finding after weight loss surgery, they're just not that much bothered by it, or they don't have that much loose skin, and they're just comfortable the way they are. But some folks do say, I think it is bothering me, or I'm having some issues with it, I want to have it removed. And then for those folks, we refer them to our plastic surgeons for skin removal.
Right. Keeping my eye on the chat. Not seeing any other questions. While you keep thinking, just know that you'll receive an email from us after probably next week sometime with an opportunity. If you missed asking some questions this evening, this will be an opportunity for you to share those with us, and I can get those to Dr. Aman. And we'll also ask for your feedback about the presentation because we want to make sure that future presentations are as helpful as possible. So really interested in your feedback about what you appreciated about tonight and where you thought maybe we could improve. So you can expect to see an email from us next week. I'm not seeing any more questions in the chat. Dr. Aman, did you want to say anything else before we wrap up?
I just wanted to take a moment to thank you all. Thank you all for spending a portion of your evening with us. Thank you for your great questions. Thank you for the privilege of your time. Thank you so much, Kristen, for your help in organizing and executing this meeting. And I just want to wish everybody a wonderful and safe Veterans Day weekend. And with that, I will kind of wrap up and hope everybody has a great weekend. Thank you so much.